They were four men living all together, yet they were all alone. Till the one day when the lady met this fellow, and they knew that it was much more than a hunch, that this group must somehow form a family. That's the way we all became the Brady Bunch, the Brady Bunch, the Brady Bunch. That's the way we became the Brady Bunch.
So, before we dive into the topic, let us first have a brief overview about the normal tissues which can be found inside the oral cavity, starting with the teeth. So, the teeth are hard calcified structures in the mouth used for biting and chewing food. They consist of different parts including enamel, the outer layer, dentine, a softer layer beneath the enamel, and the pulp which contains nerves and blood vessels. So, basically po, yung ngipin ay calcified tissue structure na nasa loob ng bibig natin. Commonly, ginagamit po natin ito sa pagkagat at pagmuya ng pagkain. Binubuo ito ng iba't ibang bahagi as mentioned po, kabilang ang enamel or ang outer na layer and hardest component ng ngipin, yung dentine na mas malambot na layer sa ilalim ng enamel, at yung pulp na nag-house ng mga nerves at blood vessels. Ang next naman po is yung periodontal ligament. So, the periodontal ligament is a group of specialized connective tissue fibers that attach the tooth to the surrounding alveolar bone within the mouth. It acts as a shock absorber during biting and chewing and helps maintain the position of the tooth. So, ang periodontal ligament is yung connective tissue fibers na nagdudugtong sa ngipin at sa alveolar bone. Mayroong 5 fiber groups ang PDL, which is interradicular, apical, oblique, horizontal, and alveolar crest group. Nagfa-function ito bilang, as mentioned po, is yung shock absorber kapag kumakagat o ngumunguya. At tumutulong din ito sa pagpapanatili ng tamang posisyon ng ngipin. So, para po siyang spring, and important din po ito sa movement ng teeth during orthodontic treatment like sa braces. Lastly, yung cementum is a calcified tissue that covers the roots of the teeth. It helps anchor the teeth to the periodontal ligament and provides protection to the underlying dentine. Cementum is essential in maintaining the stability of teeth within the jaw. So, ang cementum naman po is also a calcified tissue na bumabalot sa ugat ng ngipin. Ito ang nagsisilbing pang-angkla sa ngipin towards sa periodontal ligament at nagbibigay ng protection sa dentine na nasa ilalim nito. Mahalagang bahagi ang cementum sa pagpapanatili ng tibay at stability ng ngipin within sa ating panga. In addition to what was discussed earlier about the human tooth, let's have a bit of an overview to the 3 primary layers of the tooth, which is the enamel, dentine, and pulp. Each layer plays a crucial role in the overall function and health of the tooth. Firstly, with the enamel. This is the outermost layer of the tooth and is the hardest substance in the entire human body. As discussed po previously sa oral histology, it is primarily composed of 95% inorganic material called hydroxyapatite, a crystalline form of calcium phosphate. The enamel's main function is to protect the underlying layers of the tooth from physical and chemical damage, such as the wear and tear from chewing and the acidic environment created by bacteria in the mouth. However, the enamel is not invincible. It can erode over time due to acidic foods, poor oral hygiene, or abrasive brushing. Second is the dentine, which is situated sa ilalim ng enamel. A less hard but still durable tissue na composed ng 75% ng inorganic material. It also makes up the bulk of the tooth structure. Dentine is composed of microscopic tubules that connect to the pulp chamber. These tubules make dentine sensitive, especially when the enamel is worn down, exposing it to external stimuli. Unlike enamel, dentine can regenerate to some extent, but it is still susceptible to decay if the enamel is compromised. Lastly, the pulp. The pulp is the innermost layer of the tooth, and it is considered a soft tissue which contains the tooth's nerve tissue and blood vessels. The pulp is essential for the nourishment and continued health of the tooth, as it supplies nutrients and oxygen. It also serves as a warning system as it responds to pain when something is wrong, such as when there is decay reaching this inner layer or a tooth fracture. If the pulp becomes infected or inflamed, it can lead to severe pain and may require treatment such as root canal to save the tooth.
Alveolar process. The alveolar process is the part of the maxilla and mandible that houses the tooth sockets or the roots of the teeth. It is a bony ridge that provides structural support for the teeth. This is like the foundation of your teeth. Ito yung part ng jawbone na humahawak sa mga ngipin para manatili silang nakaayos. Imagine as poste ng bakod ng ngipin at ang alveolar process ay parang lupa that keeps our teeth sturdy and secure. Katulad ng lupa na pwedeng i-shape at galawin, this bone can change over time, especially if you lose a tooth or get braces. Dental pulp. The dental pulp is the soft, innermost part of the tooth containing nerves, blood vessels, and connective tissue. It is responsible for the formation of dentine, the sensitive layer beneath the enamel, and provides nutrients to the tooth. The dental pulp also plays a crucial role in sensing pain, responding to damage or decay, and contributing to the overall vitality of the tooth. Basically, it's the heart of your tooth. Much like how the heart has arteries and veins, this part keeps your tooth alive and healthy by delivering nutrients and sensing pain. If something goes wrong, like a cavity getting too deep, ito ang dahilan kung bakit nakakaramdam ka ng sakit o pangingilo. Gingiva. The gingiva, commonly known as the gums, is the soft tissue that surrounds and protects the teeth and underlying bone. It forms a seal around the teeth, acting as a barrier against bacterial invasion and infection. Healthy gingiva is firm, pink, and closely attached to the alveolar bone, while inflammation or disease can lead to gingivitis or periodontitis, affecting oral health significantly.
Hello, I'm Giomar Kapua and I am here to talk about how we get dental caries and how we handle them. There has been a lot of theories on how dental caries accumulate. The worm theory, chemical theory, chelation theory, and even more. Dental caries or cavities develop when bacteria in the mouth produce acids that erode the enamel, the tooth's protective outer layer. This process starts when sugar from food are left on the teeth, providing food for bacteria. The bacteria metabolize these sugars and produce acid as a byproduct, which enamel demineralizes. If this process continues, the decay can penetrate deeper into the tooth, reaching the dentine and eventually the pulp. We have common factors for dental caries. First, we have the bacteria, time, sugar, and of course, the host. Now, let's have the methods to address dental caries. For non-operative therapy, first we have mechanical or chemical removal of plaque. Second, chemical modification of plaque. Use of fluorides, dietary composition, salivary composition, and stimulation. These are some of the examples of preventive measures to prevent cavities from forming in the early stages. Control of disease progression according to the caries concept proposed by Fedoreskov and Manji 1990. Biofilms on teeth are the one and only prerequisite for caries. They are necessary but not a sufficient cause because of the multifactorial nature of the disease. There are numerous determinants that may influence the outcome by either increasing And that's when restorative procedures transpire. The restorative procedures are where cavity preparation is done and defined as the mechanical alteration of the tooth to remove defective or friable structure. This preparation will receive the restorative material that will return the tooth to its proper anatomical form, function, and aesthetics. To give some examples of the restorative materials used for caries restoration, amalgam, composite resin, glass ionomer, resin-modified glass ionomer, peat and fissure sealant, preventive resin restoration, a traumatic restorative technique. Currently, there are no vaccines available for dental caries, but research is ongoing. The concept behind a potential vaccine is to target the specific bacteria, primarily Streptococcus mutans, that are responsible for the majority of dental caries. The vaccine will work by stimulating the immune system to produce antibodies that would either neutralize the bacteria or prevent them from adhering to the teeth, thereby reducing the risk of caries formation. The aim is to inhibit adhesion or to reduce virulence, most often by the use of vaccines against epitopes on Streptococcus mutans. The surface-bound antigen 1 or 2 and glucosyltransferases in Streptococcus mutans are the most studied cell surface targets for possible immunization against dental caries. Immunization approaches are directed against single microbial species, knowing the ability of microorganisms to form biofilms and to adapt and transform in such environments.
Good morning, everyone. I'm Janice Jasmine, and for our next topic, we have pulpal disease. Pulpal disease occurs when the dental pulp becomes inflamed or infected. So, what can cause this disease? This can be due to deep caries, which is the most common cause that penetrates the enamel and dentine, reaching the pulp. Then we have trauma or fractures, which is the physical injury to the tooth that can cause pulpal inflammation or necrosis. Then, chemical irritants, which is the prolonged exposure to chemicals during dental procedures or from restorative materials. Lastly, we have thermal injury, which is heat from the repeated dental procedures or restorative materials that can damage the pulp. So, there are different inflammatory processes in pulpal disease. First, we have the initial inflammation, which is the reversible pulpitis. Early stage inflammation is characterized by hyperemia, an increase in blood flow to the pulp, which is the body's response to the injury. At this stage, the pulp tissue can still recover if the irritant is removed and inflammation subsides. Then we have progressive inflammation, which is the irreversible pulpitis. If irritant persists, the inflammatory response intensifies, leading to tissue damage. This includes the release of inflammatory mediators like cytokines, prostaglandins, and luteolins, which increase vascular permeability and lead to infiltration of immune cells such as neutrophils and macrophages. The continued inflammation can cause necrosis of the pulp tissue, leading to irreversible pulpitis. Lastly, we have the pulp necrosis, which is the untreated irreversible pulpitis that can lead to the complete death of the pulp tissue. The necrotic tissue can serve as a reservoir for bacteria, leading to further complications such as periapical abscesses. So, what are the clinical significance of this? First, we have the diagnosis and management. Distinguishing between reversible and irreversible pulpitis is crucial for treatment. Reversible pulpitis can often be managed with conservative measures such as removing the irritant and placing a protective restoration. Irreversible pulpitis typically requires endodontic treatment or the root canal therapy to remove the necrotic pulp tissue and prevent further complications. So, what are the possible challenges we face in treating pulpal diseases? One of the primary challenges is the accurate diagnosis of pulpal status. Symptoms of pulpal diseases can vary widely, and progression for reversible to irreversible pulpitis is not always clear-cut. Additionally, patient factors such as pain tolerance, their age, and their immune status that can influence the presentation and progression of the disease. So for our next topic, we have periapical disease. Periapical disease such as abscess develop when an infection spread from the pulp to the periapical tissue, which is the area around the root of the tooth. So what are the different inflammatory processes in periapical diseases? First, we have the acute apical periodontitis, which is when the infection spreads from the necrotic pulp to the periapical area, it can cause acute inflammation. This involves the release of pro-inflammatory cytokines and chemokines attracting immune cells such as neutrophils which attempt to contain the infection. The inflammatory exudate can increase pressure within the bone, causing pain and tenderness. Next, we have chronic apical periodontitis. If the acute phase is not resolved, it can progress to chronic apical periodontitis. This stage is characterized by the formation of the periapical granuloma, where the body attempts to wall off the infection. Over time, chronic inflammation can lead to resorption of the surrounding bone and the formation of a cyst or abscess. Lastly, we have periapical abscess. An abscess can form if the infection continues to spread, leading to accumulation of pus in the periapical area. These often associate with severe pain, swelling, and systematic symptoms like fever. It is important to note that antibiotics can help manage the spread of infection, but they do not eliminate the infection within the tooth. They reduce the bacterial load and help control the infection, but without treating the source, like performing a root canal, the abscess may recur. So what are the clinical significance of this? First, we have diagnosis and treatment. Periapical disease often present with significant clinical symptoms such as localized pain, swelling, and tenderness to percussion. Radiographic examination is crucial in diagnosing the extent of the disease. Treatment usually involves root canal therapy to remove the source of infection, and in cases of abscess, drainage may require. So what are the possible challenges we face in treating periapical diseases? The main challenge include mainly managing the infection and preventing the spread of the disease to the adjacent structures such as the maxillary sinus or the mandibular canal. Additionally, the presence of complex root canal system or calcified canal can make endodontic treatment more difficult. Another challenge is the potential for systematic spread of infection leading to conditions like cellulitis, which require more extensive medical intervention.
The less you know, Eugene, the better.
Good day everyone, I am Denise De Ocampo, and next topic we're about to discuss is gingival diseases. Gingival diseases encompass a range of conditions affecting the gums, varying from mild inflammation to severe tissue and bone damage. These diseases are a significant concern in dental health as they can lead to serious complications if left untreated. So now let's discuss what are the types of gingival diseases. If gingivitis is not addressed, it can progress to a more severe condition known as periodontitis. It occurs when the inflammation extends deeper into the supporting structure of the teeth, including the bone. This leads to the formation of pockets between the teeth and gums where bacteria can become trapped and cause further damage. Over time, this can result in destruction of the bone that supports the teeth, leading to gum recession, tooth mobility, and eventually tooth loss if left untreated. Periodontitis is a major cause of tooth loss in adults and requires more intensive treatment such as scaling and root planing, and in some cases, surgery. The most common type of gingival disease is what we call the gingivitis, which is characterized by inflammation of the gums due to plaque buildup. Plaque is a sticky film of bacteria that accumulates on the teeth when oral hygiene is inadequate. In gingivitis, the gums become red, swollen, and may bleed easily during brushing or flossing. Despite these symptoms, gingivitis is generally painless and reversible with proper oral care such as regular brushing, flossing, and professional cleanings. Another type of gingival disease is the gum recession, where the gum tissue pulls back from the tooth, exposing the root. This can be caused by aggressive tooth brushing, periodontal disease, or even genetic factors. Gum recession can lead to increased sensitivity, a higher risk of decay in the exposed root area, and an attractive appearance. Treatment may involve modifying brushing techniques using desensitizing toothpaste or, in more severe cases, surgical procedures, such as gum grafts to restore the lost tissue. To sum it all up, gingival disease, which range from gingivitis, periodontitis, and gum recession, are significant problems that require treatment. Maintaining proper oral hygiene and receiving regular dental care are critical steps towards avoiding these diseases and ensuring long-term oral health.
We interrupt this program to bring you a special report.
Now back to the show. On Nick.
What's up, gamers? It's Mr. Beast. For today's video, we're talking about inflammation and gingival diseases. Inflammation. Inflammation in the oral cavity is a natural response to injury or infection. When a person bites something hard, it can cause trauma to the periodontal ligament or surrounding tissues, leading to inflammation. This is characterized by redness, swelling, heat, and pain. In the case of irreversible pulpitis, for instance, bacteria invade the pulp through deep caries or a cracked tooth, causing inflammation that cannot be reversed, eventually leading to necrosis of the pulp tissue if untreated. Gingival diseases. Gingival diseases include conditions like gingivitis and periodontitis. Gingivitis is the mildest form, characterized by red, swollen gums that bleed easily. It is often caused by plaque accumulation and is reversible with proper oral hygiene. If untreated, gingivitis can progress to periodontitis, a more severe condition where the gums pull away from the teeth, forming pockets that become infected. This can lead to bone and tooth loss.
This is Snoop Doggy Dogg, D-O-double-G, filling in for Brandon Francisco, cause he's too lazy to read this. All right, here we go. Periodontal diseases. Periodontal diseases are serious infections of the structures surrounding the teeth, including the gums, periodontal ligament, and alveolar bone. Conditions like pregnancy gingivitis and juvenile periodontitis occur due to hormonal changes that increase the susceptibility of the gums to inflammation and infection. In pregnancy, increased levels of progesterone can enhance the response to plaque, leading to gingival inflammation. In adolescence, hormonal changes during puberty can similarly affect the gums. Treatment focuses on maintaining good oral hygiene and managing the underlying hormonal changes to prevent further progression. Common clinical signs include swollen, bleeding gums, and in severe cases, tooth mobility due to bone loss.
It's the president of the free world, ya boy, Barack Obama. Here to talk about dental caries for Group 3 to pass this class. Dental caries, overview. How do dental caries develop? Dental caries, or cavities, develop when bacteria in the mouth produce acids that erode the enamel, the tooth's protective outer layer. This process starts when sugars from food are left on the teeth, providing food for bacteria. Bacteria metabolize these sugars and produce acid as a byproduct, which demineralizes the enamel. If this process continues, the decay can penetrate deeper into the tooth, reaching the dentin and eventually the pulp. Methods to address dental caries. Restorative procedures like fillings, crowns, or root canals are common methods to treat dental caries. In the early stages, fluoride treatments can help remineralize the enamel and prevent cavities from forming. Are there vaccinations available for dental caries? Currently, there are no vaccines available for dental caries, but research is ongoing. The concept behind a potential vaccine is to target the specific bacteria, primarily Streptococcus mutans, that are responsible for the majority of dental caries. The vaccine would work by stimulating the immune system to produce antibodies that would either neutralize the bacteria or prevent them from adhering to the teeth, thereby reducing the risk of caries formation.
Hi, it's me, Mr. Beast again. Turns out I have the best voice among the voice pack. Look, I can even say, "Hi, Dr. Hertz, I love you." Anyways, I'm here to talk about periapical diseases. Periapical diseases, pathological process. How does an abscess form? An abscess forms when an infection spreads from the pulp of the tooth to the surrounding periapical tissues. The body responds to this infection by sending immune cells to the area, which results in the accumulation of pus, a mix of dead tissue, bacteria, and immune cells. The pus creates pressure and inflammation, causing pain and swelling. Not all abscesses require antibiotics. Often, the source of infection within the tooth must be treated with a root canal or extraction to prevent the infection from spreading. Pharmacological effects of antibiotics in dental abscess. Antibiotics can help manage the spread of infection, but they do not eliminate the infection within the tooth. They reduce the bacterial load and help control the infection, but without treating the source, e.g., performing a root canal, the abscess may recur. Pathway of the abscess. An abscess begins when bacteria enter the pulp of the tooth, often through deep decay or a crack. The infection spreads down the root canal and into the surrounding bone at the tip of the root, forming a pocket of pus. This abscess can cause severe pain and swelling, and if left untreated, it can spread to other areas, leading to more serious health complications.
Hey, Snoop here. I want to give a shout out to my homies Group 3, and I'd like to let you guys know that this video is sponsored by Top 1 Dental Laboratory. Just go and hit up my OG Brandon. Here I'm going to discuss a little bit more about gum disease. Gingival diseases. Overview. Different types of gingival diseases. Gingival diseases include conditions like gingivitis and periodontitis. Gingivitis is the milder form, characterized by inflammation of the gums due to plaque buildup. It can cause redness, swelling, and bleeding, but is reversible with good oral hygiene. If untreated, gingivitis can progress to periodontitis, where inflammation spreads to the supporting structures of the teeth, including the bone, leading to bone loss. Periodontal diseases. Focus on common clinical issues. Why do pregnant women and adolescents develop periodontitis? Pregnant women and adolescents are more susceptible to periodontitis due to hormonal changes. During pregnancy, increased levels of hormones like progesterone can enhance the inflammatory response to plaque, leading to gingival inflammation known as pregnancy gingivitis. Similarly, hormonal changes during puberty can make the gums more reactive to plaque, increasing the risk of periodontitis. Overview. Treatment for periodontal diseases generally involves improving oral hygiene, professional cleaning to remove plaque and tartar, and in more severe cases, surgical interventions may be necessary. Maintaining good oral hygiene is crucial to prevent the progression of these diseases.
And now, here's a word from our sponsor.
Hi guys, it's me Chiopua. This is me brushing my teeth, day 1.
Round and round, brush your teeth from left to right. Brush your teeth in the morning and night. Brush, brush.